the surgeries didn't really help. I'm not really improving. Like how do we move forward? And we had a good communication with the doctor, and the doctor was like, I think it's best for you to med board. And I was like, well, I want to get better. I don't want to med board. And it was like, well, you're kind of shit out of luck, to be honest. And I'm like, oh, well, that's great. So my med board process was, I think, about 9 months total, but I kind of fought the initial ruling, on my med board because for me, I really tried to make sure that I medically retired instead of, medically separated, and, I don't know if you're aware of this, but, it's that magic 30%, of your disability, what dictates if you medically retire or separate. And so, like, I could have made bank if I medically separated because my injury was due to a combat or training environment. They were going to give me, like, I don't know, it was like $70,000 lump sum and tax free, and it was like, wow, that's a good chunk of change. Like, you know, and it was very enticing for me. But for me, it was like I was more concerned about making sure I had health care and that because that scared the shit out of me, to be honest. I was hearing all the horror stories of how much healthcare, so I really wanted to push for medical retirement over the separation. Um, but it was kind of a mess, to be honest.